Dr. Deuell.
Are you concerned that the federal government will go more into debt by expanding Medicaid?
Well, I'm going to blank now. The Congressional Budget Office, the CBO, has done the numbers. They're a nonpartisan, group in the government that has said that implementing healthcare reform would save in the long run and decrease our federal budget. Those are the numbers that we go with because we always go with those. But we do feel that when you're looking at the taxpayer's budget, that individual does save money, because right now we're spending for uninsured folks at the local level. We are sending up our federal tax dollars that we're not really going to get back in any other way.
But the expansion would increase the federal debt. Yeah, well.
My understanding is the implementation of the entire Affordable Care Act would decrease the federal debt, would have savings and not contribute to the federal debt.
Well, are you saying that Medicaid as it exists now in the federal government doesn't increase the federal debt?
Medicaid as it exists now does contribute to the costs of our government.
Which increases the federal debt. Are you concerned about the current people that are now insured in that eligible income range? Are you concerned about the fact that they will lose their insurance and other people will lose the private health insurance that they now have?
Could you explain? So who?
Okay, let me tell you what will happen. If we expand Medicaid, there are people in that eligibility profile that currently have private insurance. A lot of employers will make a decision to drop that and let them go to Medicaid. That will then shrink the private insurance pool. That will then in turn raise premiums. That in turn then will cause other employers and other individuals to drop their private insurance. And what you're going to do is you're going to insure one group through Medicaid, which is a system that's not adequate at this point. Hopefully we can work at that a little bit. But right now, 31% of physicians take new Medicaid, 50% overall take it. You're going to create a new class of uninsured people at higher income levels that are going to lose their insurance. That is going to happen. So,
could I say two pieces to that? One, that was a big concern with CHIP when the CHIP program was done.
And it happened.
But it was a very low percentage rate, and I don't have it off the top of my head, but I believe it's less than 1% dropped private health care coverage to move over, which didn't make a big impact. We also have the Massachusetts model to look at, and they have not experienced an overwhelming shift in this way. Also, the higher income groups of this new uninsured group would have access to the exchange.
Yeah, well, they started out with 6% uninsured, and it brought it down to 3%. So, does that mean if Texas did what Massachusetts did, does the uninsured rate go from 24 to 12, or does it go from 24 to 21?
With the projections that were done by I don't remember his name, Dr. Klein and Dr. Murdoch, show that with moderate enrollment uptake, our 24% uninsured rate should drop down to about half, 11 or 12%. If we do Medicaid expansion, and if we don't, we would see it drop to about 17%.
I might dispute those numbers. What do you think would happen down the road if given the overall federal economic situation and debt, if the federal government withdrew their support of funding the Medicaid expansion?
Right. I know that is a major concern, and again, it was a big concern when we passed CHIP, and I believe that when we passed CHIP, we included on there that if the federal government ever reduced the match rate that we would be able to get out of the program. The Arizona governor has included the same kind of language, and it's something that we could look at. And we can also make this program work, for our state. I think there's room to think through it, but we are going to be supportive of a new opportunity to provide people who don't have any access to health care coverage outside of the emergency room a way to access preventive care.
And that's sort of I won't say a myth, but many of the people who are uninsured have access to health care beyond the emergency departments. They go to local clinics, they get care from local physicians who provide care at reduced prices, they go to FQHCs. I mean, there's church-based clinics. I wish there were more of them. The church would step up a little more. So, you know, the premise of all of this is that having insurance gets you health care, and that if you don't have insurance, you don't have health care. And that's not true.
It's not 100%,
right.
but what we're seeing is at the local level, hospitals today are spending $5 billion a year on uncompensated costs. The hospital groups say those costs will be greatly reduced if we can instead spend $1.3 billion over the next 4 years on this population instead of the $20 billion that we're currently spending.
They also spend a lot of money on Medicaid patients who go to emergency departments inappropriately. So that necessarily doesn't stop that. Do you think? I think it's the figures a little over 1 million, 1.3 million that might be enrolled under the expansion. If we did that, and the federal government did withdraw their support, and they probably will, if history's any indication, do you really think that if we got that 1.3 million people dependent on Medicaid that we could stop it?
Well, I think that
Yeah,
Texas leaders can do what they think is right for Texas under the circumstances. The Women's Health Program was something that we've done one way for a while, and it no longer worked for the majority of the legislature that way, and we are changing. So I do think we do what we feel is best for our state.
Well, we will continue. I appreciate your testimony, and there are people out there who I respect a lot that are advocating for the expansion, but I think it's not the panacea that everybody thinks it is, nor is Medicaid in general. I mean, I support it, and I take Medicaid in my practice, and I believe for certain segments of the population that we should do it, and keeping in mind that 2/3 of our Medicaid budget are blind, aged, and disabled. And I would say that many of those people could have afforded long-term care insurance in the productive part of their life and chose not to buy it and got themselves in a situation. But there's a siren song going on with this expansion, and it will have long-term consequences on this state that we may not be able to dig out of, even with the help of the federal government. And the federal government is not in a position to do this. They're $16 trillion in debt. They have Medicaid, Medicare, Social Security obligations over $100 trillion. And we have to be careful who we're asking to, would you borrow money from your parents if they're bankrupt? I mean, we're putting our children at the federal level more in debt if we do this. And there's an alternative. There's the Patient Choice Act filed by Senator Coburn and Senator Burr and Representative Ryan in Washington that has a lot of things that we can do. So, I welcome the discussion, but for us to think that taking this Medicaid expansion is going to solve the problem long term and solve it for some people is just not true. It sounds good, but sometimes when things sound too good to be true, they're not.
Right.
And, but again, I appreciate your presentation and other people that are advocating for this. Again, these are people, including your group, that I respect. But we have to be real careful about what we do long term for the state, or we're going to be like other states and in debt, hopelessly in debt, looking to the federal government to bail them out. And but I want everybody to have health care, but I think there are better ways to do it. But thank you for being here. Thank you.
Thank you.
Thank you.